Cristina Soguero Ruiz is also from Spain. She has a PhD degree in machine learning with applications in healthcare. And in 2015, from University of Rey Juan Carlos and Universidad Carlos III, has dedicated her last years to research about this topic. Today, she's going to share with us a project related to using data science to address antimicrobial resistance. And their approach focuses on predicting the emergence of multi-drug resistant bacteria in the intensive care unit by modeling it as a classification task. Without further ado, I wanted to welcome Cristina to the stage.
Thank you, Anna. Can you hear me properly?
Yes, we can hear you, we can see you, everything is all set. In case you want to share some slides, now it's a great moment to do so.
Yes, I can.
We're very excited to hear about you and your project.
Okay. So here we are.
I'm going to stop sharing mine.
Can you see my screen now?
And not yet. It usually takes some seconds.
Yes.
But basically, you would have to select the slides and then click OK.
Okay.
So now we are going to have a bit more technical talk from your side, in which you'd go into the depth into how to fight this problem that really is a problem that is affecting everyone, especially in the Western world, where we use a lot of medicine to fight all the diseases that we get affected for. So this is really a very, very pressing problem.
Yes, I think I have the same problem as Victor, because I trying to share it and I
no problem. So then we can share the screen on our behalf so that you can focus on the actual presentation.
Well, meanwhile, I would like to thank you to the organizer of the Data Science for Social Good Summit, and also, Anna, especially to you, because I think it has been really nice to have your support and during this for this event. So today I'm going to talk about supporting and interpreting clinical decision making based on the power of data. And well, first of all, I also would like to thank you, the team I'm working with, and also the Spanish government, because we have been funding with 2 projects, and which allows us to research further in these topics. So, well, first of all, I would like to start with a drawing painted by a girl of 7 years old. And here you can see the doctor and the patients. And what can see? Well, in this drawing, we can see that the doctor is typing without taking care of the patient. So, and this is a real life. Nowadays, when we go to the doctor, we spend a lot of time, or the doctor spend a lot of time just typing. So why not using all this kind of data to extract knowledge and to support clinical decision data? As you already know, there are data in many around us. We can compile data from TripAdvisor, Twitter, Booking, Google, Facebook, LinkedIn, and we can use this data for different purposes. For example, to suggest new friends, find the best candidate, or recommend a new destination. But of course, regarding clinical data, there are many, well, also to predict. Regarding clinical data, there are many kind of, Victor said, thank you for the introduction, because I think we are in line. There are many kind of data from different sources. For example, in the next slide, we can see data from diagnosis, drugs, free tests, blood samples, radiology, free tests, vital signs, images, and so on. And as already Anna and Victor said before, there are a lot of challenges. Sometimes when I'm going to more machine learning conference, people told me that we people who are analyzing clinical data, we complain quite a lot. But it is a fact that analyzing clinical data is really challenging. Victor already mentioned some of the challenges we need to deal with. For example, scarce data, temporal data, heterogeneous data, how we need to combine different kind of sources, unbalanced data. Normally we have a lot of healthy patients, but maybe we don't have like illness patients. So we need to deal with all of these challenges. In this presentation, we are trying to see and to show you different examples when we are able to merge electronic health record data and machine learning data to support decision. For example, we can identify risk factors, we can monitor the current situation, for example, in the ICU, or we can predict future events. Since I started my PhD, using this kind of data, I've been working in different applications. For example, early prediction of anastomosis leakage, prediction of surgical site infections, prediction of postoperative delirium, analysis of chronic conditions, prediction of multi-drug resistance, cardiovascular events. Prediction is a little bit related with the Victor's idea, and also cancer trajectories. I don't have time to go through all of these applications, but I will try to give you some inputs to show you how we can use this data. Can you, Daniel, go to the next slide? Okay, so here is the first sample I would like to share with you. In this problem, we wanted to predict anastomosis leakage using a free test, and using a backward model, we extract more than 65,000 words, and we will try to predict if the patient will suffering from anastomosis leakage or not. So we got two insights. The first one is related with, Danny, can you go through the next slide, please? Yeah, here we can see that, as I said before, we have twofold objective. On the first one, we can provide a temporal prediction about if the patient is going to suffer anastomosis leakage or not. And on the second goal we got was that we can identify relevant words in order to detect that this is going to happen. So we can save a lot of money, and also we can help the patients to be safer. Another application is the prediction model for postoperative surgical site infections. It's something that normally happens after any surgery. And in this case, we were dealing with sparse data. We were analyzing blood samples, and using feature selection, we were able to classify these illnesses. Specifically, we identify which blood tests are more important to identify this problem before the surgery and also after surgery. And we are now working on trying to use this on real scenario. Other applications we are really focused on that nowadays is the characterization of chronic patients. In Spain, taking into account the age of the population, a lot of people are dealing with diabetes, hypertension, and so on. So the idea is using demographic data as well as diagnosis and drugs and procedure related with the patients. We are developing different models. For example, this one is using self-organized maps to classify or to cluster patients in the proper groups. And this project was really the insights we got were really great. For example, we were able to identify healthy patients in blue, diabetic patients in orange, but also a different kind of diabetic patient. We are not insulin dependent, which is really great. Probably the most important and relevant insight we got was trying to identify a group of patients who were all of them pregnant women, and all of them were hypertensive. We can see them in red. And also we can see just hypertensive patients who were not pregnant women. So this is an example of how we can support clinical decision making in this scenario. And right now, since I got several projects, I'm really focused on trying to identify antimicrobial resistance in the intensive care unit. This is a really great problem nowadays, and using like patient data, culture data, and antibiotic data from more than 15 years, we will be able to develop different machine learning models to predict this in the intensive care unit. So reading the newspapers, the news, and like scientific reports, there are like a trend, or there is an opinion that there is a trend of the trend of some family of antibiotics to some bacteria is increasing. So this is the state of the art, but this is also happening in the ICU of Fuenlabrada Hospital. So we were dealing with this problem, and we got it that, as we can see in the slides, yes, here we can see that, for example, from bacteria called Pseudomonas, there are the trend for different antibiotics, like, for example, fluoroconins or penicillin of wide spectrum. They are increasing over the years, so this is a big problem. And something similar can be seen for the next, the STENOTROPHOMONAS. We can see that for some antibiotics, the trend is increasing quite a lot. So, taking this into account, we were able to predict, using simple method, if we can able to predict what is gonna happen during the next year. Here we can see that the trend, okay, that we more or less can have like good prediction using simple model. I don't have time to go deeper into these results, but in the link below, you can see the papers we are dealing with, as well as the final projects and more details about this project. Here, here in this problem right now, thank you, we are just analyzing antibiotics, different family of antibiotics, because it has been shown that the higher the amount of antibiotics the patients are taken, the higher the probability of getting multi-drug resistant in the ICU. So for dealing with this problem, we pick up 7 days time windows, as we can see in the slide. And the idea was to be able to pick up which are the most important antibiotics to detect if a patient will suffer from multi-drug resistance. Here, I don't want to go into details, but we will see, or we can see that there are different antibiotics which are more important for this task. In the next slide, here we can see that there are different models, and we are working right now in deep learning models to improve the results. But in summary, we can see that we can get with results just based on the antibiotics the patients are taking in the ICU. So using this data and after future selection, we consider is something important. We in touch with the clinician of the ICU, got it that this can be a first steps for going further. And as Victor said before, we are at the university, but our campus is just running in just next to the hospital, and we think that this is really important. So we are in touch basically every day, because we think that having their knowledge is really, really important to continue and to have like important insights. Otherwise, I think it is not gonna be possible. And just to conclude, we think that we are just starting to get where we need to be. I totally agree with Victor. We need to not just publishing. We need to create tools and method that they can use in the clinical practice. So the way is harder. There are a lot of stone, a lot of steps, but I think we need to be there, and I think as a community, we have many ideas to share and to put into practice. So yes, I would like to thank you, all of you, and if you have any doubt, because I basically go really quickly to the different applications, but you have my email in this slide. So please, if you need further information about any of the application I just mentioned, please contact me. Thank you so much.
Now you can hear. Yes, so especially since there would be other people that are trying to create a similar path as the one that you created, it would be really interesting for them to get to know more about your background, more details on your investigation. So if you can share the links after, everyone would appreciate it. Thank you, Cristina.
Thank you.